All right. Well, let's hope that I don't have any audio issues with this segment like I did last time, so I apologize for that. I want to now introduce you to our next three presenters. We are going to learn about exercise, adaptive equipment, and DME, and we will hear from our three presenters. Dr. Kim Carter is an assistant professor in the Department of Physical Therapy at the University of Tennessee Health Science Center. She has been practicing physical therapy for 25 years and is board certified clinical specialist in neurology. She has worked at the Memphis MDA Clinic since 2012 and recently presented her research at the 2019 MDA Clinical Conference. Then we will hear from Jana Knickerbocker, who is an occupational therapist board certified in physical rehabilitation. And I will just let you know that her and Kim both do our PT and OT at our MDA Care Center in Memphis. And then we will hear from Will Mattern, who graduated from the University of Southern Mississippi with a bachelor's in science and therapeutic recreation. After graduation, he worked in Utah at an adaptive sports center and then moved back to Mississippi, where he began working at rehab directly with patients who have suffered with spinal cord injury. And then in 2016, he began working in the industry of assisted technology. And since 2006, he has been with our Muscular Dystrophy Care Center in Jackson, Mississippi, with Dr. Witt and Dr. Shukla, who you guys will hear from later. So, Kim, I will go ahead and turn it over to you.
Nicole, it says that you've disabled my video.
Okay.
Okay.
Now, there you go.
Great. All right. All right, we'll get started. So like Nicole said, my name is Kim Carter, and I'm going to talk briefly about exercise. A common question that we hear at the clinic is exercise going to do me any good? And the short answer to that is yes, exercise is beneficial for everyone as long as it's performed in a safe manner. So some quick general guidelines here is you always want to consult a physician before you start any type of exercise program. And ideally, you would see a physical therapist after your doctor says it's okay to help you develop that exercise program. You should never exercise to fatigue. And if you have muscle cramps or pain while you're exercising, you should stop doing that exercise immediately. So although we don't have a huge body of research that looks at people with neuromuscular disease and exercise, the studies that we do have recommend exercise. And many of the medical guidelines that we have for the care of people with neuromuscular disease include exercise as part of that medical management. In general, what is recommended is aerobic exercise, strengthening exercise, and flexibility. And I'm going to talk a little bit about those. So once again, with aerobic exercise, you want to talk with your doctor before you start any type of aerobic exercise program. And if your diagnosis affects the cardiopulmonary system, you definitely want to talk with your doctor about that. In general, submaximal aerobic exercise is recommended. And what that means is intensity of the exercise. We measure intensity of aerobic exercise usually by heart rate. And you may have heard the old equation that's been around for a long time, which is you do 220 minus your age, and then you get a number. And then you do a percentage of that number to determine what your heart rate should be for exercise. And submax exercise, you wouldn't want to do anything above 65% of that number. And that is something that if you talk to a physical therapist, they could help you out with. And it is sometimes hard, though, when you're exercising, doing aerobic exercise, to check your pulse or to check your heart rate. And so another great test to do is what's called the talk test. So while you're doing aerobic exercise, you should be able to talk. You may not be able to break out into song, but you should be able to talk to someone while you're doing your exercise. If not, then you're exercising too hard. Make sure that the aerobic exercise that you choose is not compromising your safety and or your joints. And what I mean by that is if you have some issues with balance when you're in a standing position, then probably doing a treadmill or an elliptical trainer is probably not the best idea. The goal of aerobic exercise is to work your cardiovascular system. And ideally, you'll get to where you can work up to 30 minutes. And so if you're doing an exercise that's compromising your safety, you may not be able to exercise safely for a determined amount of time. You also don't want to do anything that's going to put undue strain or stress on your joints. So in other words, if when you stand, you tend to maybe put a lot of arch in your back, or you tend to hyperextend your knees to get your balance or to stay stable. When you're on a treadmill or on an elliptical trainer, that actually might put more stress on those joints, and it might be better to do an exercise in a more seated position. In general, you want to start with a 5-minute warm-up to get the heart and the muscles ready to exercise, and you want to end with a 5-minute cool down. I always tell folks that you should start with 5 minutes of exercise, of aerobic exercise, and then kind of see how you feel the next day. In the beginning, when you start doing aerobic exercise, I would suggest you do 2 to 3 times a week and make sure you have a day of rest in between. This is a picture of modes of aerobic exercise that we generally recommend. From left to right, this is called a recumbent bike, where you're kind of sitting in a seat in front of the wheel. This is called a recumbent stepper. This is a really nice ergometer where you can work your arms and your legs. And then this right here is what we recommend quite a bit at the clinic, and that's because it's pretty affordable. This is called a peddler, a PEDLAR, or a foot bike. You can also use this for the arm as well. This is just a little metal frame that's got pedals on it. They do make them a little bit more sophisticated looking, but you can get one of these on Amazon for about $40, and they're great for aerobic exercise. Another question we get a lot at the clinic is, can I walk for exercise? And the answer is yes, of course you can. You just want to do it safely. So some things that we have found at the clinic that help patients walk safely is, for example, if you tend to use a rollator. One thing that's great about a rollator is it has a seat. So if you're walking along and you need to take a rest, you can sit down in your rollator. However, what we find, what a lot of folks will tell us at the clinic is, well, the seat on the rollator is too low to the ground, and it's hard for me to stand up for that. So what we recommend is that you think about purchasing what's called a rollator cushion. If you put that in Amazon, this right here will pop up. It's a 3-inch thick foam cushion that you can attach with straps to the seat on your rollator. And it's pretty firm foam, and most people that have used it have really liked it a lot. It makes it easier for them to get up and down from that rollator seat. If you're walking, but you find that sometimes you do have a little stumble or with your balance, but maybe you're not using a cane, one thing that we also recommend is maybe the use of what's called a walking pole. These are poles that you see sometimes people walking on trails with. What's nice about it is that it's adjustable. You can make it very short, so you could throw it in your purse or into a bag or into your car. So if you go somewhere and you realize, oh, I'm going to be walking further than I thought that I was, it's a nice little addition that you can use to help keep you steady and balanced when you're walking. If you have difficulty clearing your feet when you're walking, or your toe hits the ground when you're walking, it's probably time for you to think about getting what's called an AFO, or ankle foot orthosis. And what's great about this is that it fits in your shoe. It puts your foot at a better angle to make it easier for you to clear your foot. We have a lot of folks that will say to us, well, if I get this brace, then my ankle's not going to get to work and I'm going to lose that muscle. And what we usually say to that is that's probably not going to happen. But what is going to happen is that it's going to be easier for you to clear your foot. You're not going to have to use as much energy when you're walking, and you're less susceptible to fall. So it's a win-win situation. And the last thing I was going to say about walking is that walking downhill is not really recommended. When you're walking downhill, you're using your muscles in more of a braking type mechanism, and you're using a lot of your muscles in a more lengthened position. And when we use our muscles in a lengthened position, that's called eccentric exercise. And eccentric exercise is not really recommended for people that have neuromuscular disease. I want to talk real briefly about strengthening exercises. Once again, consult your doctor first and then ask for a physical therapy evaluation or a referral. In general, strengthening is recommended at moderate intensity. So if the highest weight that you can lift with your biceps is 10 pounds, then you would not want to lift that. You would want to do about half of that would be the threshold of what you would want to lift. In general, what the research has found that muscles that can be moved against gravity are the safest to strengthen. However, I want to say that it's so important that you perform the exercise with correct form. Many times you might be doing an exercise, but you might be putting a strain on your back or a strain on another joint. And if you're doing that, then you're really not getting the full advantage of that exercise. And so that's why it's really good to think about getting a referral to physical therapy. And the last thing I want to say is that sometimes what's best is to do what we call gravity eliminated exercise. So this next slide illustrates that a little bit. So what this gentleman on the left is doing is he is working the muscle on the side of his hip here, called the gluteus medius, against gravity. So if he was to lift his leg up against the in the air here, he would be moving that muscle against gravity. If that's too difficult for you to do, what the physical therapist might have you do is then do the exercise in a different way where gravity is eliminated. And so you see here, this gentleman is still sliding his leg out to the side. So he's still using that muscle on the side of his hip, but he's just not doing it against gravity. Flexibility exercises are also very, very important. Once again, consult with your doctor first. It's important to have correct form. And one thing that I really want to stress here is that to really stretch a muscle, you need to hold the stretch for about 20 to 30 seconds. And many times that's longer than just counting out loud to 20. So I think you should look at, I'm always telling my patients, I think you should look at your, the second hand on your watch or set a timer on your phone to really get a feel of what 20 to 30 seconds looks like. And usually, talk to your doctor about this first, but stretching every day is recommended. So I just wanted to show you 3 kind of basic stretches that we tell folks about all the time at the clinic. So one is called the chest stretch. We're going to stretch the muscles on the front of your chest here, which we all need. We're all spending more time in front of a computer these days, and we tend to get tight in the front. So this is a pool noodle that I got at Dollar Tree for $1. And this is my husband's recliner. And you can put that in the middle of your recliner, like right along where you think your spine would be. And then you see here where my husband is sitting against that pool noodle. And that can help stretch out the front of the chest. You can also do this in your wheelchair or a regular chair as well. You can even lie down on it as well in the bed if you'd like to do that. If you have a significant scoliosis, though, this is probably not a good stretch for you to do. Another muscle that tends to get tight is the hamstring. It's that big muscle in the back of the thigh. So here's a couple ways you could stretch your hamstring. One is like this gentleman is doing here, where he's sitting in a chair. He has his leg straight. This is the leg he's stretching here, the right leg. He's got his heel on the ground, and then he's leaning forward. And you could even do this in your wheelchair as well. Just make sure you're safe as you're leaning forward. Or you can do as my husband is here. I apologize, this is a very busy slide. My dogs would not get out of the picture. But this is my husband in his recliner, and then there's that pool noodle again going underneath the ankles. And if he wanted to kind of close the angle in here, he could lift up the back of the chair, and that would stretch his hamstrings out even more. And last but not least is a calf stretch. There's a lot of different ways that you can stretch your calf, but one of the safest ways I like to show folks at the clinic is in sitting. Now, this patient of mine here has a big wooden wedge here that she has her feet on, but you don't have to do that. You can use a foam wedge. Jana, who's going to talk next, has taken yoga blocks before, and with an electric knife, she's cut them on an angle, and then now you have a wedge. And so that's what is a foam wedge that's right here. You can also buy those commercially. And then you can make your own wedge. These are 2 books. And you could use a cutting board, and you could prop them up against the books, and you could put your feet on there. The key is to put your feet on the wedge and then lean forward if you're in a sitting position. If you're going to do this in standing, this is going to challenge your balance. So you need to hold on to something, and ideally you would do 1 foot at a time. So that was kind of fast and furious, but just to kind of wrap things up, recommendations: make sure that you talk to your doctor before you start an exercise program. Ideally, have the doctor refer you to a physical therapist. You don't need to go to the physical therapist for 3 times a week for 6 weeks or anything. You probably just need 3 to 4 visits to figure out the best way for you to exercise safely on your own. If what you may find, what a lot of the folks that we see at the clinic will tell us is that, well, I went to therapy and the physical therapist was not familiar with my diagnosis or disease. And that may happen. So feel free to educate them on that. And some supplements to that could be to direct them to the MDA website, where they have incredible articles about every disease and diagnosis that's underneath that MDA umbrella. It can give a really good overview for the therapist. Another thing is this link here. That is a wonderful article that was written over 10 years ago, but still holds up, about how we can safely exercise. And then the last thing is, if you would like for me to talk to the physical therapist that you have been linked up with, I'm happy to do that. And so that's my email address right there. They can contact me, you can contact me, and we can talk about some guidelines that you can give the physical therapist that you're talking with. All right, I know that was really fast. I can talk really fast, but I only have 15 minutes. So I am going to end my presentation here and then help Jana get her PowerPoint up. Sorry. Okay, the problem is that we have to shoot. Sorry, guys, we got to share our screen first. There we go. Share. There we go.
Hello, my name is Jana Knickerbocker. I'm an occupational therapist, and as she said, I work at the MDA clinic and have for quite some time. I'm going to be talking about what OT's role is in neuromuscular disease, but primarily I'm going to be also talking about the adaptive equipment that we typically recommend. There we go. All right, so what do OTs do? Nobody knows what OT is, so I always have to start to explain what OT is and what our role is in the MDA clinic. We are the ones who address the self-care, all the things that you do for yourself, dressing, bathing, cooking, cleaning, grooming, things like that. And we also address the adaptive equipment and techniques that you'll use to do those self-care tasks. We also address upper body functioning, like your shoulder strength and your hand strength and coordination. Additionally, with physical therapy, we address functional mobility, like tub transfers, toilet transfers, car transfers if needed. And then we work with the team with physical therapy and with the ATP to evaluate for power wheelchairs. All right, so what I wanted to focus on for this time are some of the adaptive equipment that I most frequently recommend for the people at the MDA clinic. I kind of broke it up by task, and this really only scratches the surface. There are so many other things out there, and I kind of just wanted to present the most common things I recommend, but know that this isn't an exhaustive list. There's tons more out there. So the first thing I want to talk about is feeding. So the two main problems that happen when people are feeding themselves is either one, they can't get their arms to their mouth, or they can't hold the utensils. And so some common things to kind of work on getting your arms to your mouth for that problem is to prop your arms on a surface. So, you know, I know your mom said don't put your elbows on your table, but ignore her, put your elbows on the table. Put your elbows on the table, bring your head forward to your hand. You're probably doing that already. The other thing is, you'll see here I have this is a armrest for computers, and it will support your arm, and you can use it, and it sets up all different ways, and you can use it to kind of help lift your arm closer to your mouth. The other thing is, you want to think about positioning more upright in your chair. It's really bad for swallowing to be kind of semi-reclined. You want to be as upright as you can be, and that will also free up your arms to help you feed yourself. The next thing are things that kind of help with the size, make it easier for you to hold on to the utensils. These are foam utensils, or not foam utensils, they're foam that goes on a utensil. And as you can see in the picture, it can go on anything else too: pencils, pens, razors, combs, toothbrushes, etc. The other thing is the bendy fork is what I call it. There's a lot of wrist motion that occurs when you are feeding yourself, and that may be difficult for some folks. And so these forks allow for, it just makes it easier to get the food into your mouth. You don't have to have as much wrist motion. Another thing I recommend are divided plates. It makes it easier to scoop with those divided plates. This over here is a one-way straw. And I put the website, that arctherapeutic.com, because that is the best place to buy them. And you don't have to get this little yellow thing here. That's just an additional thing. But the straws are one-way valve. So you know how you suck up liquid in a straw, and then when you quit sucking, the liquid falls back down into the cup? What this does is you suck the liquid up and it holds it there in the straw, so that the next time you go to suck, you don't have to suck it up as hard. And this is an easy way to get that. The next thing is a cup that is you slide your hand into. It makes you easy for you to pick it up. You don't have to grab it with your fingers. And they make lots of different things like this. Tervis has things that go around the outside of a cup so that you can just slide your hands into it. The next thing are ideas for dressing. There are a lot of different things that you can use for dressing. This, again, this just barely scratches the surface, but I just picked some of the things that I use most frequently or recommend most frequently. The first thing is a button hook. You can buy well, I've got where you can buy them all, but Amazon sells them. This is actually called I think it's an OXO brand. It may not be. But I really like this one because it's got this rubber handle and these ridges here, which make it easier. This is the side, the button hook side is the side you slide into your buttonhole and catch the button and pull it through. And then the other side is got this little hook on here that you hook onto a zipper and you pull it up. So like your zipper on your pants, or now it's getting cooler, your zipper on your jacket. It makes it easier for that to hold on to. The other thing I recommend is look at your clothing. There's a lot of clothing that you can just change your style of and make it adaptive, such as slip-on pants as opposed to button-up pants. These are blue jeans and they look really nice. They look like regular blue jeans, but they're just slip-on. The next is shoes. Slip-on shoes are amazing. And I know that Skechers and Merrell, and there's some other plans that really make some nice slip-on shoes. I do not recommend Crocs though. I know everybody loves their Crocs, but they're a little hard to walk in and they're not as secure on the foot. And so you may kind of find that it trips you up. The other thing I wanted to show you are these clothes, and I put the link here, and I'm not trying to be an advertiser for them, but Tommy Hilfiger came out with an entire line of adaptive clothing. And it's amazing. I've actually seen them in person. They look like this shirt looks like a button up Oxford shirt, and it doesn't button at all. It works on magnets. So like the magnets that you have when like women have on their purses and things, this is exactly the way it works. It just clips together and it's very strong. And they have pants and different shirts. And anyway, they have a whole selection of clothing. The other thing is think about dressing lying down. When it comes time to put your pants and shoes and socks on, maybe consider doing that lying down. It might be a little easier for you. Now, it will be easier to do your upper body dressing sitting up, but the lower body dressing sometimes is more easily done lying down. Next is toileting. The biggest problem that people have with toileting is the height of the toilet. This is a pretty consistent problem. Your average toilet in a house is about 16 inches tall. If you go out and you buy a handicap toilet that you can get at Lowe's or Home Depot, it will be approximately 18 to 19 inches tall. Well, that might be okay for some, but generally, most people need their toilet to be closer to 22 to 23 inches tall. So you want to find things that's going to get that toilet up higher. So one of my new favorite things is this toilevator. I like it a lot because it goes under the toilet. It doesn't clamp on, so there's nothing that could, make you lose your balance when you sit on the toilet. You may have to get a plumber to help you with it, but you may not. It's fairly easy to install. You do have to remove your toilet and install it, and there's long screws that come with it, and then you have to put the toilet back on there. And if that's above your ability, then I would call a plumber. But it raises the toilet up 3 to 4 inches, I think. The next one is just your typical bedside commode or a raised toilet seat with handles there. That will get you up much taller as well, and it goes over the top of the toilet. The only problem with this is you have to kind of watch about your side, how wide your space is where your toilet is sitting. This final thing is, I show people the Cadillac and the cheap stuff. So this is the Cadillac. This is a lift. You can see it over here. It works like a lift and recline chair that you may have seen, but it goes on your toilet, actually powers people and lifts you up. It gets pretty doggone tall, and it moves fairly slowly, so you have a chance to adjust your balance. I'm not gonna lie, it's not cheap. But I have had people really like it, but also because it's kind of portable. They can take it with them if they're going somewhere. The final thing I want to talk about is hygiene after toileting. Sometimes it is difficult to reach to do all the hygiene. And so some have found this thing, it's called a bottom buddy. And you stick your toilet paper in there, and then it has this handle, and it makes it a lot easier to clean after toileting. Bathing is the other thing I get a lot of questions about. There's a lot of different equipment that you can use for bathing, and it's hard to recommend what's going to be best for you without seeing you and knowing kind of what your problems are, and also the setup of your house. Everybody's home is a little different, and when it comes to bathing, there are so many things that have to be taken into consideration before we talk about adaptive equipment. But generally speaking, most people find that if they have a walk-in shower, this shower chair here works very well for them. It's adjustable. You can get it up pretty high. I think it maybe about 20 inches. Don't hold me to that, but I'm thinking that's right. The other one, if you've got a bathtub with a handheld shower, you might want to consider this tub transfer bench. Actually, if you're getting into the bathtub, this is the way to go. You can put the chair in there. The chair is cheaper, but it's just not as sturdy getting into the bathtub. I much prefer this tub transfer bench. It does take up a lot more room in the bathtub, but it's much safer. It goes half in the bathtub, half out of the bathtub, and you sit down on it and you swing your legs over. The next thing is just handrails in the shower. I like these curvy ones that go in front as well as to the side, but you want to think about your handrails not only being inside the shower, but also outside the shower, because or bathtub, because you need it to be able to hold on to when you step in and out. So think about them being in both places. And people always say, where should I install them? Well, first they need to be installed in a stud, and next they need to be installed where your hand reaches. Where are you reaching to hold on for something? That's where you want to put it. When it comes to walk-in showers, there's a lip that you usually have to step over. This is called a Lego ramp, and if you Google Lego ramps, you will literally see people who've made ramps out of Legos. This is not what this is. This is actually, that's what it's called. It's called a Lego ramp, but it's put together similar to Legos because you can make them in any height, any slope, etc. And they're wonderfully diverse. If you find their website, you will see there's just tons of things you can do with this. But easy to clean, it can get wet, it's durable, and it's a nice option for the shower. Finally, again, I like to show the Cadillac version. If you just gotta get in the bottom of that bathtub to get that soak in, this is a power lift for the bathtub. So it raises up, you sit down on it, you swing your legs over, you lay back, you lower it down in the bathtub, you have your soak, and then you come back up and reverse the process. The problem with this is that you still have to get in and out, and you still have to be able to dry yourself. Although I do think I have heard some people using a Hoyer lift and with a sling that they can get wet, and then they use the sling and they lower them onto this bench and then lower the bench down into the tub. So you're bathing, but the sling for the Hoyer lift is still there. So you gotta have a backup, a dry backup. The last thing I want to talk about are home modifications. Once again, this is just scratching the surface because there are loads of modifications that can be done for the home. As a matter of fact, I would recommend that if you are considering having a lot of changes made to your home, you may want to consult an OT that specializes in home modifications, or look in your area for a builder who specializes in modifying the home. Because there are guidelines that need to be used, and there's a lot of little tricks out there. The biggest thing people usually need is a ramp. You know, churches and Boy Scout troops and people, they're wonderful about building ramps for people, but you've got to make sure that they are building it correctly. And at the very minimum, for every inch of rise, meaning for every inch of a step that you have in, you need a 1 foot of run, meaning length. So for every go up, you need to go a foot out, which, you know, if you consider the average step is about 3 to 4 inches, that's 3 to 4 feet out from your house. So that's quite a bit of distance. But that's what the minimum is required to get a power wheelchair or a regular wheelchair up. The next thing are bed rails. You don't have to have those on a hospital bed. You can buy them separately, and they are wonderful to help push up. Next, this is another kind of Cadillac-y thing, our drop-down cabinets. You pull this little handle right here, and it pulls the cabinet down so you can reach it. My daughter would love that. She's kind of short. So it's great, but you do have to be able to reach to at least the bottom height of the shelf, because that's where that handle is. The other thing you might want to consider is lowering the countertops to make them your height. There are tons of new environmental control units out there, like voice activated lamps. You can get Siri or Alexa or whoever you like to do just about anything. Turn on my TV, Siri, turn off the lights, ring the doorbell, whatever, call for assistance. There's loads of things those things can do these days. Finally is an electric chair lift. This goes on, obviously, as you can see, goes on the side of a stairwell. It helps you get up to the top. The thing you have to think about is you got to have something up at the top of the steps for you to go to, like a walker or a wheelchair, if that's a necessity for you. So you have to have one kind of upstairs and one downstairs. The other thing is when installing this, they remove that handrail. So if other people in your family need that handrail on that side, then that might not be your best option. Another problem patients run into is that their bed is too tall. If this is the case for you, you can purchase what's called a half a box spring, and that may lower it down enough for you. And finally, doorknobs are a lever doorknob right there, just to make it easier for you to open and shut doors. Again, just scratching the surface. Another thing we get asked a lot of is how do I get my family member up off the floor if they were to unfortunately fall? You know, obviously you have the option of calling the fire department and getting them to help, but here are a couple, and these are you know, pricey options that could help as well. This is an air lift that helps people get up off the floor. What you do is if you're on the floor, you roll to your side, the little blue thing there goes under your hips, you sit on it, you press the button, air inflates, boom, 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 and you are sitting up. But if you notice, this lady's behind him, and that is because I don't think this is a very stable surface. To be honest, I haven't tried it out. I've been wanting to buy one just to try out, but they are kind of pricey. But you do, so you not need some stability there. And then finally is your Hoyer lift. You can always use the sling to the Hoyer lift to help get someone up off the floor. I do highly recommend that if you are receiving therapy and this is an issue for you, or maybe you get an order for therapy because falls are an issue for you, that this is something you talk to your therapist about, especially your physical therapist. They know a lot of tricks to help get people to get up off the floor. Where do you buy all these wonderful things? That's what I always get asked. Also, you need to know that insurance will not cover most of what I talked about. However, check with your insurance, because some plans are beginning to cover some forms of adaptive equipment. But generally speaking, you're paying out of pocket for this. So where do you buy it? Of course, Amazon is my favorite go-to place now. They seem to have everything. And so I typically refer people there. Other places like Dr. Leonard's catalog, and I think it's Carolyn White, not Debbie White. I couldn't think of her name. I think that's it. Those catalogs that you get in the mail. Just know that if you order one thing out of those catalogs, you'll be getting them for the rest of your life. Alamed is another website, as well as rehabmart.com. And then sometimes Walgreens, CVS, all your pharmacies, sometimes they have a lot of that stuff as well. I kind of keep my eye out on things. And then your hardware stores have a lot of things in their plumbing department. Thank you for letting me speak to you today. I also want to just mention as well that, if you feel like you need some assistance with some self-care tasks, get an order for OT. But be very honest with your OT and very advocate for yourself and say, I'm coming here. This is the problem I'm having. This is what I want you to help me solve. Be very open with that and help guide the therapist so you get what you need. And thank you again. And I'm going to turn it over to the next person.
All right. Hello, everyone. Thank you so much for giving me the opportunity to come and speak with you guys today. My name is Will Matter, and today I want to talk to you guys about choosing the correct mobility equipment the first go round. So why is this so important? Well, it's important for so many reasons, but just to name a few, in most cases, your insurance company will only pay for one mobility device every 5 years. So it is so important when you're choosing that mobility device to choose the correct one first time. Now, there are some exceptions to this. If you are a child and you have a major growth spurt and that chair is no longer fitting you, your insurance possibly will provide a different mobility device before that 5 years is up. Another possible exception is if you have a major change in your medical condition, your insurance may provide a different mobility device before the 5 years is up. Now, these are exceptions. These are definitely not the norm. Another reason it's important to choose the proper mobility device the first time is your mobility relies on this device. There is a misconception that if you are in a wheelchair, that your mobility will be limited. And that is just not the truth. The purpose of that mobility device is to give you more independence, to get you going places that you want to go and doing the things you enjoy doing. The next reason that it's really important to choose the correct mobility device the first time is your body's positioning depends on it. An ill-fitted wheelchair can actually do more harm than good. So if that wheelchair is too big or too small or doesn't have the correct positioning components on it, it can actually do more harm to you than good. So it's important to choose the correct mobility device. Another reason is your mobility device has the capability to increase your level of function. You know, that mobility device, again, is designed to give you more independence, to allow you more freedom to participate in your activities of daily living. So it is crucial that you choose the correct mobility device first time. So I want to talk to you guys about how to obtain the proper mobility device. A couple things that you can do is have your evaluation completed at a reputable location with qualified staff. You know, there are muscular dystrophy clinics across the United States, and they do an excellent job at making sure they have good quality team members there to help you. They typically have good physicians there, therapists there, and equipment suppliers there to make sure that you're getting the proper device. So if you are being evaluated for a mobility device at a muscular dystrophy clinic, you're on the right track to getting a good piece of equipment. You know, your physician should be familiar with the equipment they are providing. Your therapist should know the equipment, and they should know how to justify the need for the equipment. And your supplier should be a certified assistive technology professional. The next thing to do in thinking about your equipment is think about your home environment. Think about your work. Think about how that equipment is going to be used in your environment. And make sure that that equipment is going to be appropriate for your environments. You know, ask yourself the questions, will it fit through my doorways? Ask yourself the question, do you have a way of transporting the device? You know, if you are being recommended a power wheelchair and you have a small compact car, and you're going to have an issue with transporting that device. So make sure you have means of transporting the device. And then ask yourself the question, is that mobility device going to give you the freedom to do the things you enjoy doing? And then the final thing is know what's available. You know, there are so many options available out there in the mobility world now. And it's important that you know what's available, whether it's covered by your insurance or not covered by your insurance. It's important to know. So let's talk about the steps to obtaining the correct mobility device. There are 5 basic steps to obtaining a mobility device. The first step is you're going to see your physician, and that physician is going to document the need for a mobility device. Now, when they are documenting the need for this mobility device, it is going to be in their standard chart note format. This is not going to be where they write a letter of medical necessity. It's going to be charting in their standard documentation the need for a mobility device. The second step is that physician is going to send a prescription to your therapist for a wheelchair evaluation. Now, at times, if you are receiving this mobility device from the muscular dystrophy clinic, that process is done a lot of times all in one day. You'll see the physician, the therapist, and the equipment provider will be there, and that whole process can take place all in that day. The third step is the evaluation. So in the evaluation, the therapist and the supplier are going to take measurements of you. You can have an opportunity to try different equipment. You will select the equipment, and during that evaluation process, the therapist and the equipment supplier will be there guiding you through those decisions. The fourth step is after the equipment is chosen, the supplier will go back and they will secure the funding for the equipment. And then once the funding is secured, they will order the equipment. And then the final step is the equipment is fitted to you by the therapist and the equipment supplier. It's always a good idea if you can be fitted for that equipment at the same place that you're evaluated for the equipment. The therapist would be there, the equipment supplier would be there. And it's just a good way of making sure that the equipment that you are receiving is what you originally spec'd out and that it's fitting you properly. This is not always the case. There are times where the therapist and the supplier are not together at the same time during the fitting. But if at all possible, it's a good idea to have the therapist and equipment supplier there. Now, this process can take anywhere from 6 weeks to 16 plus weeks, depending on the funding source. If everything goes perfect, your insurance is quick to approve the equipment, and the equipment is ordered, it can take as little as 6 weeks. Now, unfortunately, a lot of times the insurance gives us problems, and it can take much longer than that 6 weeks. I typically tell patients that this process is going to take somewhere between 8 and 12 weeks. And again, it just depends on your funding source. So I want to talk to you guys about what's available. There are all sorts of things available in the wheelchair world. There are manual wheelchairs. As far as manual chairs go, there are different types of manual chairs. There are ones that fold. There are rigid frame manual wheelchairs. There's manual wheelchairs that tilt and recline. But I want to talk to you guys about a device that can be attached to your manual wheelchair, and that is called a power assist device. As you can see here in this picture, the device that is between the two wheels, that is a power assist wheel. It's called a Permobil Smart Drive. And this is basically a lightweight, removable motor that is attached to the manual wheelchair. That smart drive is activated by either a push of a button or a tap of a wrist, and that motor begins to move your chair forward. So when the motor is moving the chair forward, you simply have to steer the manual wheelchair. So this is an excellent device to reduce fatigue, to reduce overuse injuries from propelling a wheelchair. So this is a power assist device. Now, as far as the power wheelchair world, there are so many options available, but I wanted to point out a seat function called a seat elevator. As you can see in these pictures, it has many benefits for the end user. This is a device that may or may not be covered by your insurance. Currently, Mississippi Medicaid is covering seat elevators. How long they're going to do that, I'm unsure, but this is a seat elevator, so it raises your chair up to 14 inches, depending on the seat elevator. There are many manufacturers that you can get a seat elevator put on your wheelchair. Permobil makes them, Quantum makes them, Invacare makes them. Pretty much all the big wheelchair companies have a seat elevator that's available. There are some foundations that will help cover seat elevators. There is a foundation called the Gleason Foundation. They will help cover seat elevators. Permobil has a foundation that will help cover seat elevators, as well as Quantum does. There are also standing power wheelchairs. This particular model here is a Permobil F5 VS standard. It's made by Permobil. There are other manufacturers who make standing power wheelchairs. Invacare has just come out with a standing power wheelchair. And then a company called Motion Concepts makes a seating system that can be added onto a power wheelchair base. This again is another option. Depending on your funding source, it may or may not be covered. Now I want to talk to you guys about alternative drive controls. Now there is a misconception that if you cannot use your hands to drive a power wheelchair, then you can't drive the power chair. And again, this is just not true. This particular lady here is using a chin control. So the piece that is directly underneath her chin is what she is using to drive the power wheelchair. And then the button or the switch on the right side is there to allow her to turn the chair on and off, as well as access her seat functions like tilt and recline on her power wheelchair. This is a foot controlled joystick. This particular gentleman could not use his hands and had limited head control, but he had good use of his foot. And so, as you can see on this right foot plate, we set up a joystick to where he could drive the power wheelchair using his foot. This particular girl here could not use her hands to drive the power wheelchair, and so we set up a device called a head array. And so she uses her head to control the power wheelchair. And so just as I said at the beginning of this presentation, the purpose and the design of these power wheelchairs are to give you freedom, to give you independence, and to keep you going. And so there are so many options available in the wheelchair world to keep you independent and as mobile as possible. So thank you guys for allowing me to speak today. Again, my name is Will Matter. Here's all of my contact information. If you have any questions today or in the future, please feel free to call me, email me. I'd love to help you any way I can. Thank you.
Thank you, Will. Thank you, Jana and Kim. So what are the alternatives to a standard joystick? This person needs something like a TV remote that can fit in their hand because it's becoming harder for them to reach the Permobil joystick. Is there anything out there for them?
Yeah, so I'll answer that. There's lots of options. Really depends on your need. It's hard to say exactly what you would need, not there, but some of the manufacturers that make alternative drive controls and alternative joysticks, there's a company called Adaptive Switch Lab.
Okay.
They make some really good joysticks. There's another company called Switch It that makes good alternative drive controls, and then Stelt and Body Point are also companies that have different joysticks.
Okay. And Jana, you had talked about the bathtub lifts. Where would someone get information on those?
Well, again, most stuff you can get, you have to look at Amazon or just
Okay.
Google the bath lift. Sometimes your DME dealers that do like your Hoyer lifts and your hospital beds and your generic manual wheelchairs,
Okay.
sometimes they sell them too.
Okay. We got some questions that were emailed in prior to this, but one gentleman was asking, he tends to lock his knees when he walks. Is he doing damage to his knees? Or is that part of it, just how he is, how he walks?
It would depend on the degree of how much. Okay, let me back up. So tell me the question again. He's locking his knees when he walks.
Yes, and he's curious if he's hurting his knees by doing that.
Okay, so ideally we would not lock our knees, right? We would use muscle action to secure the knee versus, bending the knee back to where the joint is what's the locking mechanism of the joint. I would need to see how much he is locking to see how much damage. In general, we don't want to do that. Okay. However, for some folks, that's how that they can be stable in a standing position. You don't want to stand like that for a long period of time. And what he might find is walking with a pole, like we talked about earlier, or walking with a rollator. He can put more of his weight through his arms, and then that can decrease the amount of stress on his leg, which would then cause his knee to not lock as much.
Okay. Is there anything that can be done to help people with their balance?
Oh yeah, definitely. There's lots of things that can be done. Immediately
exercises?
Yes, there's lots and lots of exercises that can be done. That's not something that I could talk about over a, you know what I mean? You'd have to, and that's why I think it's so important to go and see the physical therapist, because to work on balance, then you need to do things that put you out of balance, which you probably don't need to be doing at home right now. And then there are you can work the muscles that help you catch your balance, but that's why it's good to get a physical therapist, take a look and see what can be done to help you out. But yes, the question was, can exercises help with balance? Yes.
And someone had asked earlier, Are there any resources to help purchase a stander? Because insurance, do they or do they not cover a stander?
Well, again, I mean, that comes down to your insurance.
Mm-hmm.
Mississippi Medicaid will cover standing frames. Some Blue Cross policies will cover standing frames. Really depends on your insurance.
Okay. Okay. And would Medicare cover a Hoyer lift? This person's having trouble finding a dealer for a Hoyer lift.
Yeah, Medicare will cover a Hoyer lift.
Okay. Okay.
I want to add something real quick
Yeah,
about
go ahead, Kim.
something that we like to recommend the folks that come through our clinic is that if you are going to get a Hoyer lift,
Mm-hmm.
that you ask your doctor to get you an order for home health therapy to come and have them show you how to use that Hoyer lift.
Okay, yeah, I imagine that's important.
Yeah, it's so important. And many times the person that deliver it will show you as well.
Mm-hmm.
But I think it would be a good idea to ask for either PT or OT to come out to the house and show you how to use it safely.
And what is your opinion on water therapy? Whether water aerobics, swimming, when is that too much for someone? I know your point.
More than likely, water exercise is always going to be good. I didn't talk about that a lot in my presentation because and the reason why I didn't, first of all, there's been a lot of studies looking at water therapy, aquatic therapy, and it's great. The buoyancy of the water decreases the amount of stress on your joints. It makes it a lot easier for you to move.
Mm-hmm.
The problem is finding a place that you can go and do water therapy.
Mm-hmm.
Getting in the water and getting out is the issue. Putting on a bathing suit, taking off the bathing suit, where are you going to go and get that done?
Mm-hmm.
Many places have a lift to get you in the water, but when you get out, you've got to find a place where you can, disrobe and change. Many dressing rooms do not really have a place for you to do that. They've got a bench that's really low on the ground, and
that's a good point.
Or the area that they have for you to change is real little bitty, and it's not great. Another issue that can be happening is that unfortunately insurances have kind of decreased their reimbursement of aquatic therapy, and so a lot of physical therapy places that had pools do not have them anymore. I did hear of a place that was opening up kind of in the middle of Mississippi, but I have been unable to contact them that had aquatic therapy. If you can find a way to do aquatic therapy with a physical or occupational therapist, highly recommend it. It's absolutely wonderful.
Okay.
I just didn't mention it because unfortunately there's just so many barriers.
Sure.
And another barrier, I'll just put this in there, another barrier can be, especially if you join a place that has a pool that also hosts a swim team.
True.
When that swim team is practicing, they have the water very cool. And for many of us, we don't find that to be very enjoyable. We would like it to not be ice cold. So that can be a deterrent as well. So if you do join somewhere, find out what the temperature of that water is going to be. Because if it's ice cold, you're not going to enjoy yourself. So
that's a really good point. And this person just typed in that they have both Medicare and Medicaid. So just to confirm, that would help them pay for a stander.
So Medicare does not cover standing frames.
Okay.
Yeah. So Medicare does not cover them. Now, if it's Mississippi Medicaid, and especially with like wheelchairs and stuff, sometimes Medicare will deny the product, and Mississippi Medicaid will cover and approve the product. So standing frames with Medicare, they typically are not going to cover that.
Okay. Got it. All right. I just wanted to check real quick in the chat. I don't see anything else, and I know we didn't get anything emailed. So thank you, all of you guys, for your time this morning, and appreciate you taking some time out on Saturday to help us. So thank you.
Absolutely. Thank you.
All right. We'll talk to you guys soon.
All right. Bye-bye.